Welcome back. Brushbeater medical segment. I'm Mech Medic, the primary medical instructor here at Brushbeater.
I am Teddy Bear. I'm a civilian physician, and they let me stick around as long as I don't lick the windows too much.
So today we're going to be kind of wave topping some IFAC trauma equipment, kind of hitting some of the common questions that we get asked, that I see in class, and we see in comments, online, all the stuff. So here at the store, they sell a couple of different options. You have the MFAC, and then the MFAC resupply. This is just a real kind of bare bones minimum. If you're looking for something to like throw in a backpack, or you only have a little bit of space on a piece of nylon to throw something, this is perfect for it. You have a tourniquet, set of gloves, pressure dressing, set of compressed gauze, and then some mini hyphen chest seals. All of this stuff comes from North American Rescue. This is all top quality, like top of the shelf equipment, stuff we use in the Army, all across the DoD. It also comes with a set of NAR shears. These are the only shears I buy anymore. These are the mini version. They're amazing. They cut through anything. The blades on them last better. There's rubber molding inside the grips of the shears. They're awesome. They're all I use. They're in my personal kits everywhere.
I just discovered that they had these today, and I need to get some because they're just nice and compact.
They're awesome. And then they have also the Torque. It's a little bit larger. This one is more kind of towards like the law enforcement or DoD side of things, like active shooter role. So you still have the tourniquet. You have a much larger pressure dressing, which is really good for some of those larger wounds. You have two things of gauze whether it be a larger wound that you have to pack or multiple wounds. You have two things of gauze. You have two sets of gloves, so if you're changing from one casualty to another, you can change those gloves out.
Or they
tear to minimize any of that fluid transfer. It does have full-size hyphens, and because the current guidelines from the Committee on TCCC says vents, that's what these use. And like I said, this is like top-of-the-line stuff. These are what we use. Hyphens are some of the best chest seals that you can get. More of these NAR shears. These things are amazing. Then you also have a polycarbonate eye shield. It's an eye covering for any sort of eye injury that you might have.
If you get into H of the March algorithm, eye injuries are going to be under the head injuries.
Yep.
You don't want to put direct pressure on an injured eye. That's just not polite.
No, it's not a good day.
So it's not a life threat necessarily, but vision is really important. You're watching YouTube. Not said.
Yes. One of our big evac things was life, limb, and eyesight. Those are the things that we on the military side would evac or move patients towards a higher level of care, was to preserve life, limb, or eyesight. So eyesight is kind of a big thing. It's important. They also have individual components. So if you just need a couple things, you don't need a whole entire kit, you just need some of the parts. They have all of those parts here. Some people prefer to roll their own. I'm one of those people, so when I have my IFACs, I like to just kind of piecemeal things, and all of those things they have here. They're all NAR pieces of equipment. They have pouches if you want to put them in there.
Then we have the Brushbeater pouches. This is not an NAR item, just to be clear. I want to make sure we're clear there. Has the very cool Brushbeater logo on the back. You'll see on the web store, it's got the duals illustrated. You can open it up, and that's kind of how it's illustrated. But you can also see you've got all these elastic bands. This was originally like this will work very well. This is basically an IFAC bag that you can use for other purposes as well, like holding your nods. So we have God's plaid. We have working man's brown.
Yep.
Which is my personal favorite. I don't make much of a secret of that.
Another thing I like about these pouches specifically is you can kind of tuck these PAL straps underneath these rows, and this is all male Velcro, or male hook and loop. It's the hook. So you can stick this if you have a backpack that has like soft-sided, whether it just be just kind of like a soft material, or even if it does have the female Velcro, the loop on it, you can stick this in there. So you can kind of throw this into a backpack and have like a ready-to-go kit to either throw at somebody or use. It just kind of adds an extra level of organization if that's something you're into.
So one of the reasons why you should buy extra gloves, particularly these gloves, is if you've ever tried to do a blood sweep with black gloves on,
Yep.
you won't see it. These tan gloves are also not nitrile blue. If you are in a tactical environment, they're tan. They're not gonna stand out like those blue gloves. Blue's great for contrast.
Yeah.
Contrast is the last thing you want in the woods. So I really like these. If you just want to pick up, I can't remember if we have a lot. I think we have. Yeah, I think we just have a tub of these too. So
Another thing I like about the non-black gloves, so specifically if you're dealing with like motor vehicle wrecks, there's more than just going to be bodily fluids involved. You have transmission fluid. Depending on the vehicle, there could be hydraulic fluid, brake fluid, engine oil, all these different things. ATF is really commonly red. So
that's automatic transmission fluid, not the AFT.
Being able to kind of differentiate what exactly that fluid is really, really important. If you want to find out why, come to class. We'll get into that. But it's really handy to not have black to be able to tell those things. And it makes it easier to differentiate if you are like in a patrol setting. I understand that sometimes you guys get issued those black gloves. I get it. They're handy for like chain of evidence type things. But having a separate color, that way you know like this is for medical, could be kind of handy in that setting.
One of the other kits I'm seeing here is the supplemental IFAC resupply kit.
The CERT,
the
those are
CERT.
great.
One of the things that I like about this, and of course the MFAC kind of resupply kit comes in as Ziploc bags, which I also really like that. This is how NAR stuff usually comes. If it's a resupply kit, it comes in compressed, tear open thing. So you've got all this stuff. You got a lot of the things we've talked about, as well as some tape.
Yep.
I know you really like 3M Durapore.
And that's exactly what that is.
That's what 3M Durapore.
NAR in their kits, they only use 3M Durapore.
Tape seems like a really simple thing until you're trying to get something to stick to skin that is designed to keep things out, and that skin is wet from sweat or vomit or blood or all those fun things. So good tape is underrated.
Yep, and these are handy. The CERC specifically, the tourniquets aren't vacuum sealed individually like they are in some of the other kits. This is great for like a grab and go, like if you're tossing, especially in like a patrol setting, if you are involved in some sort of like mass shooting event, you can throw this to people and it's already ready to go. If somebody has like any inkling of an idea of how to use this, which like teachers will generally kind of have, like a stop the bleed class or something. This could be really handy in a situation like that.
And of course, after any kind of event, you're gonna want to restock your supply.
Yeah. So that's kind of runs the gamut of the stuff they have here at the Brushbeater.store.
For the kits, obviously. There's a whole lot of other medical things that we're not going to get in for this video, just for time's sake. Litters and stuff like that. That may be another video. But thanks, guys. Let us know what you think in the comments, and be safe out there.
Thank you.